Yeah.
Got it. Did you get a little thing? So it's setting up our meeting on Facebook Live right now. And we're live.
Okay.
Linnea Baker, welcome. So nice to see you. I got to tell you, you're quite an inspiration to Linz and I. We have watched you over the last year and just watched what you're doing and how well you're doing it. Let's go into your story. Sorry, were you going to say something?
Oh, I was just gonna say, well, you were gonna say it. So, but Linnea, we know Linnea because she is one of our, like, did you do the beta group with us?
I was like one of your first groups. Yeah.
Yes. So probably 2.5 years ago, we met Linnea and she's been doing our rewind stuff with us. So
Linnea is a nurse practitioner, had a practice, and then there was a big deal you had with your son. And make sure I'm getting this right. It was somewhere in the middle of that, you thought, I'm going to switch gears and I'm going to go and become a holistic health coach.
That's exactly it. That's
Tell me your
exactly
story. Why? That's so
yeah.
different.
It's so crazy, Neil. I'm so honored that you guys asked me to speak because truly I now have my own Facebook holistic health and wellness, and I do my Facebook videos, and you guys were my inspiration because I was in your group following you guys with Rewind, and really that's all when it started with my son. So I was practicing grinding it out in a pediatric clinic on a military base, working my tail off, guys, and depleted. I didn't realize I had an autoimmune disease, wasn't pouring into myself and taking care of myself the way I needed to.
I'm guessing we're going to talk a little about that tonight.
Yeah, we are going to talk about that gut health. It's all about the gut health. So my friend introduces me to this program that's a lifestyle. I'm not a fad crash diet person or pill person. I know you're not either. It's all about the lifestyle. I get on a program to improve my gut health. Bam, 3 days later, I'm like a different person. I live that lifestyle. Oh, it was 3 days. 3 days and my life changed. Energy up, pain down, bloating down, weight going down, brain fog gone. It was incredible what I saw.
You're not allowed to say this as a person in the medical profession. You're not allowed, because that's too much, right? I've talked
I'm not saying I'm curing, but I can help you get rid of your inflammatory symptoms, which that's all inflammation. It's incredible. It's incredible.
What I mean by that is, like, it's unbelievable that you would say this, because every ounce of your training would tell you I can't make that strong of a declaration. Like, I know you doctors and nurse practitioners. I know how.
So I will tell you what's out there right now in gut health. It's about 10 to 20 years old, but when we talk about the microbiome, let's just go there. The microbiome was not even really founded till the late 1990s. Okay, so this is all newer information that's not even studied in schools or in medical programs. It's not the standard of care right now. So all of this comes from personal experience and researching what's coming out now. Okay, but my personal story and then what I've seen from my clients, it's mind-blowing what I'm seeing. I've been in healthcare for 25 years, trained in traditional Western medicine, and I know there's a place for that, but we're backwards. There's a Chinese, back in an old Chinese, one of the first Chinese medical texts, they say that the expert, basically doctor, is the one that prevents disease. The mediocre doctor treats the disease and hopefully, like, there's no symptoms, and then the inferior doctor is the one that's dealing with the end stage disease. And in the United States, we have it flipped around. We're reactive instead of proactive. We're not looking at the holistic lifestyle approach. We're looking at treatments and medications, which is great that we have them, but we really need to focus more on the holistic lifestyle and preventing disease instead of treating it once we have it. And if we can get into that lane more, which is the lane I'm passionate about, we will improve overall quality of life and health.
Yeah, it's probably not. It might have something to do with the fact that last bit costs a lot of money. I'm not a conspiracy theorist. I value medical. Now let's bring everybody up to speed while they're coming in. Okay, and hopefully we'll have some of your folks here. I know Leanne's folks from Cali.
Perfect.
Yeah. So if you will, as you're coming in, I want to show you what's going on here. We got Lindsay on the keyboards. And she'll be talking to you, and we value all of your thoughts, all of them. So as you come in today, please type to us and let us know where you're at, where you're from. We will get to all of it. For some reason, mine's not bringing up the thing, but I don't dare pull it up.
Don't try to-
Just do it.
Yeah.
Okay. So,
Technology.
so we got Lindsay over here working the keyboard. All of your questions, we will get to them. And if you will let us, we would love that. So please
Because
type
I
them.
need to know what she did in those 3 days.
Yeah, Keith says, I need to know what she did in those 3
Yeah,
days.
you know,
Not yet. We'll get
I'm
there.
not going to tell you yet, but I will tell you this. I will offer, I'm going to offer something special at the end of our talk here. So don't let me forget.
Do it now. What's your offer?
want me to
I'll-
offer
we'll-
it?
We'll do
Okay.
it double. Yeah.
So what I want to do, because I'm so passionate about what I do, and I absolutely love how you guys run your program, and we really are in alignment. I want to offer a free health consult to anyone who wants to comment in the messenger that they want to meet with me, just a quick phone call and go over some things, and I can kind of do a personalized plan if they're interested. And that doesn't mean they have to do it, but if they want the health consult, they can get on the health consult, no obligation, just getting with me and talking through some of what they have going on and that I might be able to help them with, because what I'm doing is incredible. And I'm seeing so much power in healing so many different symptoms in people. And that's what we're going to talk about tonight. That, and then the brain connection, which is so exciting.
You are on record for having said this. Let me go to your page. You said, you wrote this last week and this blew my mind. You said gut microbiome is the second brain.
Mhm.
Okay. Now what we're doing is we're talking about mental health, emotional health. This week is about emotional health. I kind of think most of these are linked. But in terms of emotional health, gut microbiome is paramount, isn't it? Like this is something not a lot of us think about.
Yeah, they actually now have neurogastroenterologists, so brain doctor, gut doctors. They specialize in both because it overlaps. Okay, so
Wow.
it's absolutely incredible and mind-boggling. So when we think of our gut microbiome, we need to think of our gut as the command center of our body. And the reason this is coming from a girl who was never focused strongly on nutrition. I tried to out exercise my nutrition. I always felt like I didn't want to be too restrictive. I didn't want to be too into the diets and the fad crash diets. I always believed in a lifestyle, everything in moderation. But the power of what we're finding in the gut microbiome, and that it's the second brain, and it interacts with our metabolism, and it interacts directly with our immune system, and it impacts our overall health and quality of life. So everything focuses on that command center, the gut. And if we don't take care of that, nothing else we do is going to make as big a difference. And that's why
the gut? Why the gut? Why the gut? That seems so, it seems like it ought to be in your brain, right? Like why gut?
It's insane. Some of the information that I have studied and gotten, and I'm telling you, I did not learn this in my medical training. Okay. 90 to 95% of serotonin, which is our happy hormone, is in our gut. It's made in our gut. 90 to 95%. 80% of our immune system is in direct communication with our gut. Okay. And so if we don't take care of our gut and the microbiome, which I'm going to tell you what that is, everything else in our bodies interacting and overlapping with this. And we're realizing now, because we didn't even know we had a microbiome till the late 1990s. Okay. So we hear this buzzword, right? Gut microbiome. Linnea, what the heck is the gut microbiome? So it's the genetic material of all the microbes, and microbes are protozoa, viruses, bacteria. Okay. And it's that genetic material. And guys, get this, it's inside our body, these microbes. Okay. And they can weigh up to 5 to 6 pounds. So when we take 5 pounds off our weight, when you do rewind and you put your weight in, go ahead and take 5 pounds off, because that's your microbiome. So us ladies, we're okay, we're winning.
Wow.
But it's absolutely insane. And what we found is there's 10 microbes to every one human cell.
Yeah.
That means the microbes outnumber human cells. And there's
by 90%.
Yeah, it's insane. Like mind blowing. I remember taking microbiology and not wanting to touch the railing on the staircase when I walked down the stairs. And now I realize I'm like a walking I'm full of microbes. It's insane, guys. It's powerful. And there's 100 trillion different bacteria. There's so many bacteria, they outnumber the stars in the universe. That's how mind-blowing this stuff is, that you can really nerd out on this stuff.
Wow.
It's incredible.
Wow. Per person. That's
Yeah,
per person.
absolutely insane. And to let you guys know, the majority of the microbiome is actually located in our large and small intestines. Okay, so it's in the lower part of our digestive system. Okay. And so we have a nervous system called the enteric nervous system that goes from our whole digestive tract, from the mouth all the way down. And that sends nerve signals. It's bidirectional. That means it's two-way communication. So our gut is communicating with our brain, and our brain is communicating with our gut. And a lot of the microbes we're making, they are, or that we're producing based on the environment and what we're eating, whether it's good or bad, that's going to produce these neurotransmitters like serotonin and dopamine. And those
And people are taking neurotransmitters for anxiety, right? They're taking
yes, anxiety,
serotonin.
depression. So there's there's obviously clinical reasons that people need to take these medications and more serious, but we know we're in a healthcare crisis. The pandemic, I mean, what I was seeing in clinic with depression and anxiety in kids is insane. It's off the chain. And they said it was like 56% depression in the United States. Honestly, I think the numbers are way higher and they're underreported, because I can tell you majority of people I talk to have had some kind of depression or anxiety at some point, if not still dealing with it. Inflation, all the things, right? And so, but when I'm taking these clients with me on this health journey, and most of them, I'm going to tell you, the reason they come to me isn't for mental health. They're coming to me because they're like, Linnea, you look great. What are you doing? Your skin looks great. You lost weight. Your energy.
You do look great. Your skin does look great. Lindsay and I were just saying that just now.
Yeah, and it's truly what you do from the inside out. It's what you're putting in your body. And so I found the easy button, the secret to how that works, and not being hungry and not counting calories and not counting macros and not starving. And so people come to me for those things. And what I'm finding, I have a client that came to me, and we were talking back and forth. She wanted to lose weight, fit into her clothes better, have more energy, typical things that are the number 1 and 2 top health concerns, right? We go on this health journey. I'm coaching her. I'm showing her this program and helping her along. Within a month, it was like week 3. This is a girl who's got a family history of depression. Father passed away from suicide when she was young. She has struggled with mental health and depression on lots of medications and going to a counselor and a psychiatrist counselor 1 to 2 times a week. So serious, right? And she was doing all the things to take care of herself, which was great. And I supported that. And then we added in the lifestyle change, and we added in the things that we did to help her on her health journey, this to increase the good gut bacteria and change her gut health and improve it. And in that 3 to 4 weeks, she went to her counselor, and her counselor said, "What are you doing?" And she said, "Well, the only thing I've changed is my nutrition. I'm working with my friend who's a nurse practitioner." And she said, mind blown. It was like the light switch went off. The darkness lifted, the anxiety, the depression. So all the medication and things she was doing, she still needs to do that because of her condition. But her quality of life and how she's thriving now is through the roof. She doesn't have to go to her counselor as often. She's down to like once every 3 months, from once to twice a week, seeing her counselor. So the mental health aspect is huge. We're even seeing,
Can I stop you and back you up a little bit?
Yeah.
Pack says she looks amazing.
Yeah, Kathy Pack says you look
Oh,
amazing.
thank you.
Kathy's a big fan. She was excited to hear about this tonight.
Love Kathy. She was back with us in the beginning. Her, Dina.
She always has been. It has to do with the vagus nerve, right? The way I understand it, the thing I understand is that the bacteria, generally your body wants to keep your brain and the bacteria of your stomach apart, but the vagus nerve connects the 2 organs, the gut biome and the brain. Can you speak a little bit to why, in terms of like there must be a transport system, it sounds like, between the gut to the brain.
Yeah, that's a great question. There's multiple. So there's different ways. We have the enteric nervous system, so you have your central nervous system, which is your brain and your spinal cord. And then we have this peripheral nervous system. The vagus nerve falls into that. The enteric nervous system, which is aligning your entire digestive system, is in that. And then you can even make these neurotransmitters and release them into the blood without going through the through the neurotransmission, like vagus and paracampus. It can just go into the blood. Okay.
Right.
So
That does
one
that.
of
The gut bacteria will talk to your brain in a lot of different ways.
in a lot of different ways, right? And so based on what you're feeding your gut, the food we're eating, and there's other things too, but the biggest one is what you're eating will change the type of gut bacteria you have. Okay, so you have good gut bacteria and you have pathogenic bacteria. Pathogenic bacteria promote disease. Normally everything's in balance, or you want it to be in balance, so we're not promoting disease. And if you aren't taking care of yourself and you're eating the typical Western diet, what happens? We have more dysbiosis, right? And then we have more of that promoting disease bacteria, and then disease that's creates inflammation. Okay. And inflammation is the playground for disease, really. And so when you talk about the vagus nerve, one thing we have to worry about is when our inflammation goes up, because we're not taking care of ourselves and our gut is in dysbiosis, we have more, we're unbalanced with the good and bad bacteria. Well, we can actually inflame the vagus nerve. So it's actually inhibiting and changing the conduction of the vagus nerve, which is part of how these neurotransmitters are getting to the brain. So when you're doing that, you're going to feel more down or feel more lousy, right? And when you're taking care of yourself, one of the things I notice in my clients, anxiety goes down, depression goes down, sleep goes up, focus goes up, positive mindset goes up. People just feel better. They have more energy, and then that ripples out and they want to do more things, taking care of themselves, working out and things.
And
so
that comes down to that gut microbiome. Like,
yes,
I've
all of it.
I've been listening to a whole bunch of stuff on this over the years, and this is brand new, just like you're saying. Like they don't have a lot of answers on this, and all of the answers they do have, there's a lot of people coming out of the woodwork going, that is not true, and don't say that. But I think they're wrong. I think they're wrong about it, because the gut, they've shown that the gut does produce those hormones. The gut produces them and sends messages through the vagus nerve to the brain. So if we block that, if you need your brain, if you need all of your neurotransmitters in order to get through an issue like stress, like, and it's not working right, then you don't have access to that. So they're proving that this is inflammation, gut bacteria, and depression are linked.
All of it, all the different psychiatric, I worked in pediatrics, I was saying, and I had a high autism and ADHD population. And I know some of the the developmental pediatricians would take red dye out. I mean, you've got to think our country, I think we eliminate only 11 different chemicals in our foods. And I was watching the HBO miniseries, like Not So Pretty, and some different docuseries and some other things. And we don't really restrict the toxins and chemicals. We have a lot of things in our food source, the GMOs in our foods, the preservatives and all the things. And our kids are exposed to this. And if you go to Europe, they have 1,300 to 1,400 different restrictions on their ingredients of what is allowed in their food. So a food they sell here will have less of a smaller ingredient panel over there. And when I saw these kids in clinic, ADHD, autism through the roof, we're talking about epigenetics now. So having a genetic predisposition to have a disease, and then something in our environment is exposing and bringing out that disease process. And
stress,
stress,
disease,
food,
something like that, right?
Yeah, our lifestyle.
Foods,
I mean, it's incredible. And actually there's some studies now in mice. So we're still lacking in human studies and big trials, because this is something that takes a lot to study in people. But we can find out what our microbiome is. And guys, little TMI, but honestly, they can study your microbiome through feces.
I know.
Right? I mean, that's what it is. It is. So, but they took mice, okay, at Baylor College, and they took mice and did an autism study. So they had these different types of traits of autism in some mice and a control. And they had mice that were in a germ-free environment, and then others that had like a regular environment, and then others that they exposed to the microbe L. reuteri. And they found that they could improve socialization in the autistic mice through giving them this microbe L. reuteri, and it actually impacted their ability to function more socially having these autistic like traits. So now what we're studying, and what's absolutely incredible, because I mean, all of us probably know people who have suffered from mental health. I have family members who have bipolar disease and have suffered from all kinds of things. They're looking at psychobiotics. So can we take a bacteria, make it a medication? And you know, of course, this is big pharma. They want to get in on this, but can we take a bacteria and know what bacteria is needed to treat these different mental health illnesses? But that would be absolutely life-changing for people who are on all these medications and still suffering and struggling with their mental health.
What are the hangups to that? Why don't they charge that even harder? That seems like that just makes perfect sense. Like I know nothing, and I can tell you that is worth exploring as hard as you can go.
I think one, anything in medicine that's been out for less than 20 years, it's like, it's not the standard of care yet. Two, you're fighting, it has to be money and all the things that go with pharma.
You
and
need to
things.
be able
So
to
I really
plan.
feel like we get hung up in the pharma side, and not that pharma is bad, because there's lots of good things about it. I don't want to be a hater or anything, but there are things that it inhibits. And our whole mindset in the United States, we are opposite. We are reactive, not proactive. It would take a complete shift. I mean, I've been in healthcare 25 years, and I can tell you, I had to get out of traditional medicine to be able to help people on a holistic health and wellness side, because it's not even though it's supposed to be embedded in our system, they don't give you the time to do that part. And you're getting everything you're doing with your codes and everything has to do with prescribing medications and doing all these things. It's just a backward system right now that's going to take a while.
They're not going to be able to patent bacteria or proper nutrition, right?
Mm-hmm.
Proper nutrition might just be the.
It's going to take a while, but there are studies going on all over the place, and mostly in animals. There's some smaller human studies, but it's absolutely incredible. And even in kids, when I was in clinic, when you talk about the gut-brain connection, you know, some things I knew well before I knew this was I would have kids come into clinic, and I had a kid with abdominal pain. It ended up being abdominal migraines. I'd never heard of that. It was a new thing for me when I was in pediatrics. I'd have kids come in with abdominal pain. I'd do this whole workup, make sure it wasn't anything serious. It was anxiety, and it was presenting as abdominal pain in kids. That's a big one.
Because of that, sorry, question. Yeah, well, because of that gut-brain connection.
It's so linking that even in kids. Yeah. And I even had a kid come in with abdominal pain since she was little. Everyone kept diagnosing it as constipation. We started going down the neuro track of it because it wasn't making sense. She got diagnosed with epilepsy, seizures. And she had chronic abdominal pain since she was little, and kind of just now it was military, so people come and go, and she ended up with me and we worked her up and found that out. But just things that so
if you fix the gut on that one, you might be able to decrease the effects of a lot of different things.
It's crazy. Yeah.
Keith has a question.
Do you keep data on your clients?
He wants to know if you keep data on your clients.
So I don't have like a formal setup that I could take like study data off of, but as far as because of my medical background, I'm all about getting a baseline and then seeing, you know, where we go with that. So I get subjective, right? Objective would be obviously the weight loss and inches. I use your tape measuring video all the time for my clients because I love it. So everyone knows you guys. But as far as it's more subjective, and then what their providers tell me, right? Because I've worked with nephrologists, I've worked with neurologists, I've talked to rheumatologists, gastric doctors, and all of them are blown away by not only what I'm doing, but they're getting familiar with it and they're comfortable with it, and they're wanting it for their patients as well and sending me people.
Sounds like it'd be hard to diagnose what'd you call it?
Dysbiosis.
Dysbiosis. Sounds like it'd be hard to, because there are so many trillions of different bacteria, all of which you need, a lot of them which you need.
So that's a great
how do you? Yeah, how do you know?
Yeah, you know, so how do you know? That is absolutely where we need to go. And that's a great question. Everyone's sitting here going, how the heck do I know if I have dysbiosis? How do I know if I'm
first of all, I think if you eat the typical American diet, typical Western diet, you have dysbiosis, probably.
Yeah. So your microbiome. So first of all, the way I interact with my clients when they come on board, I first I need to know more about them. So when I'm doing consults, it's like, tell me what your routine is. What are your health goals? And I go through inflammatory signals or symptoms that your body gives off. And this is our body giving us messages that most of us ignore.
Oh,
I was ignoring all of them because why? I'm a nurse practitioner. I've just got to put a Band-Aid on it and get into clinic and suck it up because I've got to take care of people. So for years, it's insidious, right? It builds up over time. This takes a long time. So when your body's in dysbiosis or when you have an unhealthy microbiome, you're going to have symptoms, chronic fatigue. How many of us complain of not having any energy? The amount of coffee and Diet Dr. Pepper I was drinking was insane in my clinic. And I was able to get off all of it cold with what I'm doing. Cold, no migraines, nothing, cold.
really?
It was insane. They said, hey, Linnea, no caffeine. I'm like, all right, I'm in. I don't know how this is going to go though. But I tell you, day 3, I felt like $1 million. So you're going to have low energy. You're going to have bloating. You may have constipation, diarrhea, anxiety, depression, gaining weight, trouble losing weight, joint pain, muscle aches, stiffness, acid reflux, indigestion, hormone changes like mood swings, or even having hot flashes, perimenopausal symptoms. You may have skin rashes or itchy skin. You may have diabetes or blood sugar problems. You may have high cholesterol or high blood pressure. This is all. I was actually just talking with a friend of mine in Hawaii who's a cardiology nurse practitioner. That was part of my background. I did that a long time. She's actually taking patients before they ever get diagnosed with heart disease and trying to get the risk factors and decrease the inflammation before they ever get a diagnosis of heart disease. So all of these different things can, headaches, sugar cravings, being hungry all the time, not sleeping well, brain fog, trouble concentrating. If I go down that list, how many of you are going, boom, boom? I probably had most of those, but I never put it all together. And then afterwards, I got diagnosed with an autoimmune disease. Well, what happens is when we have this chronic inflammation, our gut's in dysbiosis, we're not taking care of it the way we need to. So we're eating the typical Western diet because it's easy and it's what the norm is. And I'm grinding it out in clinic. I'm not sleeping well. All the things are falling apart. And I find out I have an autoimmune disease because over years and years and years of neglect, you end up with chronic disease when you have chronic inflammation. So obesity, type 2 diabetes, heart disease, cancers, autoimmune diseases. These are all things that can be prevented. But I was one of them, get diagnosed with an autoimmune disease. I was able to treat my symptoms. Now, can I cure my autoimmune disease with what I'm doing now? I can't go backwards and get rid of it. But
that goes back to what you were saying about the DNA, right? Some of us have these epigenetic things that happen inside of us that our bodies are already triggered to have. But they don't need to display necessarily. Is that what you're saying?
Right. So you can control the symptoms, which I was just having all these talks with some other healthcare providers. So what do? You come in with a symptom, here's a med. Oh, now you're having a side effect of that med. Here's another med for the side effect. So I have one girl that has 11 autoimmune diseases and was on 68 different medications with her rheumatologist because of how sick she was. And she is down to 4 medications. Now she still has 11 autoimmune diseases and she still needs her infusions. So that's not going away. I didn't cure her, but her rheumatologist had me come in and do an in-service with her and him because and he's actually my rheumatologist, but my stuff wasn't as severe as hers. Hers was more dramatic than mine. And what did we do? We changed her lifestyle, gave her the tools to improve her lifestyle. So she was able to get rid of the symptoms of the autoimmune disease for the majority of them. I mean, we still have flare-ups. It's not gone completely, but it's manageable. It's less often. It's fewer and further between. And so she doesn't need all the medications that we're treating the symptoms. And this medication treats that side effect of that medication. She's just taking the core things to treat the underlying disease and she's getting the infusions. So symptom control, having less pain, less headaches, losing weight, getting your blood sugar under control, getting your cholesterol down. These are things I can't tell you I can get you off your medications, but we can definitely make improvement on numbers when you're decreasing your inflammation by improving your gut health. And the number one way is with your food.
Unbelievable. Have they gotten to the point where we can do diagnosis of knee pain is this microbiome, back pain would be this one, headaches would be this one? Are we there yet?
Not yet. So there are certain biota that they can say, okay, these make serotonin, this makes dopamine. Okay, this one looks like it's linked to helping with socialization and autism. But as far as to that level, not yet. But is that where we're going? Absolutely.
Yeah,
I
I'll
mean,
bet we
it's
will.
insane. And the technology needs to get better too, right? Because right now everything's through feces. But I mean, they have taken, I know they took the feces of schizophrenic and put
Mhm. I read
schizophrenic,
that today.
you
Yeah.
did, and put
Yeah.
it in mice, and mice exhibited schizophrenic behaviors from the microbiome of the schizophrenic person.
Yeah. So
Insane.
all you have to do is reverse engineer that in
So
order
you
to start
reverse
making.
it.
Yeah.
However, I was reading today too, when you reverse it, which is a good thing, right? There's potential to do, we actually do fecal transplant, but the only reason it's indicated is we do for C. diff, like irretractable C. diff, which is a over bacteria in the colon. Basically, chronically ill patients can get it, and it's not if it doesn't respond to any other treatments, they do look at a fecal transplant. So taking healthy fecal matter, getting rid of the C. diff, and transplanting it in the lower tract of the digestive system.
I was
But
watching. I was
yeah,
sorry to cut you off. I was watching.
no,
a
go
few
ahead.
episodes.
It's
I went
exciting
way down
stuff.
a rabbit hole on this last week, and I was watching them talk about obesity, and they were finding fecal matter. They purified it. They did something. They put it in a pill. They released it in the right spot of the gut, and people started curing obesity.
That is crazy. You said that. I was reading on that too. I read all these different books and listen to different podcasts with specialists that are in the field. And you're absolutely right. So they take people who maybe would normally need gastric bypass because they cannot lose weight, liquid diet, like all of the calorie restrictions, all the things, they cannot lose weight. And they have done some studies where they've taken the healthy microbiome of people who are thin and healthy, and they put it in the person who's struggling to lose weight, and they have started losing weight without having to do serious extreme other things.
Yeah.
And they've even done twin studies with like twins. Some, one is having weight problems, one isn't. And that just blows your mind. So when we talk about how do you correct your microbiome, or what, there are certain things that you are dealt those cards and you can't change, and then there's things you can change. And when we talk about like obesity and epigenetics things, well, some of the things you can't change is they're saying, okay, when you're born, were you born vaginally or C-section? Were you breastfed or bottle fed? Did you go to daycare? Did you have animals in your house? Did you have multiple people holding you, or did you have one caregiver and you were isolated from everyone? So, were you in the NICU because you were premature? So different exposures, because basically, how do we get the not only the food we eat, but how are we getting the bacteria in us? It's any opening into our outer environment, skin touching, kissing, holding hands, pets, all these things, the foods we eat, all these things are creating our gut microbiome. So they say, and I do a lot of reading. I love to read. I'm a total nerd. You are the sum of the 5 people you spend the most time with, but that impacts your microbiome too.
So I was reading a thing again. I went down a big rabbit hole. I was reading a thing where they go to sit in certain parts of the world, and they found that certain parts of the world, they grab your face and give you a kiss, and to greet you and to say goodbye to you. And they say in those parts of the world, people are very similar in terms of what conditions they have. And they're like, we don't want to blame the kiss, but we're also not going to not blame the kiss. It was interesting.
No, that brings up another great point. This is why I love talking with you. We could go on forever, because you make my brain just start firing. I'm like, yes, because different parts of the world have different types of diversity in their microbiome. So people who live in other countries, maybe they eat certain foods and they have different exposures. So their gut microbiome diversity is different than ours. And when we say a healthy gut, we want to have gut diversity of the microbes, okay? But I was studying this too, because we talk about probiotics and prebiotics and how do you get your gut healthy. They were saying, so I'm a person that believes in probiotics, okay? But you really have to know what you're looking for, because they sell so many. And the problem is most of them don't get to where they need to go. And where do they need to go? The small and large intestine. They break down before then.
Yeah.
Okay, so that's one problem. 2, there's a point, you can't just ingest a ton of probiotics and hope that you're going to correct your gut microbiome. That's not how it works. So yeah, eating different foods is great. maybe having a probiotic, which is part of what I do. And I have a specific one I use for specific reason, but, and truly it has, I have seen people go to GI doctors for years, get upper scopes, lower scopes. They've had all kinds of studies. They have horrific stomach problems and they have no diagnosis. And the doctor says, okay, seriously, they've told me this. They're like, Linnea, I don't know if you can help me because the GI doctor, after 2 years of tests and all the things, threw some meds at me and said, change your diet, improve your diet. And they're like, well, how? I don't know. You eat better. And they're like, well, I thought I ate well. And then they tried these different probiotics they were given and it didn't work. And I said, okay, let's stop all of that. Since you don't have anything diagnosed, you have all negative workup. So we're not going to hurt anything. I want you to go on what I'm doing. And within a week, it was life-changing.
I know.
Life-changing.
Okay,
Like
a few
they looked like they
questions.
were 9 months pregnant by night. And when they went with me, all the bloating, all the abdominal distension, the slow digestion, all of it went away.
Okay, a few questions from well, here's one from Dina. This is just a really good point that needs to be brought up. She says, I openly speak to my depression. Sorry.
Hey, I've got mine on. Bifocals,
Please.
man.
I openly speak to how my depression has been completely arrested since I started working with Linnea. I'm a true believer because I tried so many different drugs to help my anxiety and depression. The side effects were worse than the help. Now, with a focus on gut health, I'm a true believer. That's a neat point.
She has a neat testimony. Oh, thanks for sharing that, Dina. Such a powerful story to share.
You said there were
And
more?
then I had a question about, so if we wash our hands and use, if we, hi Linnea, if we
Hey.
wash our hands so much and use the hand sanitizer like we've been doing since COVID, does that affect our microbiome?
Absolutely, it does. Absolutely.
The nurse comes over and asks
So-
the hard-hitting questions.
So, just soap and water. Obviously, when we're in clinic and we're in the hospital, we're dealing with different bugs, and we have susceptible patients, right? That we have to be really careful that we're not transmitting them. So yes, we're using all kinds of crazy antibacterial soap, but actually there is Fasting MD, Dr. Shaw. She's a graduated medical doctor from University of Columbia. Or Columbia University, and she was a dietitian background before that, then went into internal med, and she speaks to this. And it's this hand hygiene theory that like kids raised during the pandemic and being so isolated and washing their hands so much, it is going to change their gut microbiome. Now, we'll have to wait and see down the road, and we can correct some of that by how we eat and the things we do to correct our microbiome that we were just talking about. But absolutely, over sanitizing, over bathing, all of that, you're getting rid of the bacteria that's naturally on our skin. So there's a balance where we don't want to be too extreme. And using all the antibacterial soaps can actually be a detriment. Now, I wash my hands like crazy, but I don't.
Well, you have to. You're exposing.
Yeah.
People are exposing their wounds and stuff to you. It's a little different than what you and I do.
But at
So there
home,
are-
I'm using regular soap. I'm not using the antibacterial soap anymore.
There are trillions and trillions of microbiota. It takes a while for this colony, I would guess, to decrease the bad ones and the other ones to increase. Can you talk to how long that process is? Can you talk to how
Yeah.
one would go about changing the
Yes,
microbiome?
this is so exciting. Guys, remember when I said it took 3 days for me to see a difference? You can
Really?
absolutely see improvement in your gut microbiome by making changes within 3 days. Now, I have some clients that take 2 weeks, some take a month, some take 2 to 3 months, because everyone's gut microbiome is different. How bad they are as far as how dysbiotic, how much it's off is different. But okay, so when I was in clinic, my pain, they do the 0 to 10 pain scale. I would tell you, I didn't know I had an autoimmune disease then because I wasn't taking care of myself. I had a pain every day from head to toe, 5 to 6 out of 10. Day 3 of making these lifestyle changes on my nutrition, and that's the only thing I changed. Within 3 days, you can improve your gut microbiome. So day 3, my pain went down to a 1 to 2 out of 10, no medication. And my bloating went down and my sleep was going up. My energy was going up already. My bloating was going down and I started losing weight day 3. Now, just as fast as you can see improvement, and everybody's different, but it's possible that it could happen in 3 days. And I have seen other people do that. And that's spoken to by medical doctors, like Dr. Shaw speaks to that 3 days, because I was wondering, why 3 days? And I'm already, there's no
why
way I'm already
3?
seeing a difference. But here's the caveat. I have clients, just like you put clients on something to help, like medication, and they feel better, so they stop, like antibiotics. You give them an antibiotic, they feel better, they stop it, and they don't finish it. Well, when I put people on a health journey, some people are like, okay, I feel great, and they stop doing what they were doing. And if you don't need to do all of it, but there are certain things you need to do to maintain once you get to where you want to be. And so it can just as quick go away. So within 3 days, you can see it reverse as well. Great question. I love that question. That's an interesting one.
That is an interesting one, especially where I've heard that it can have the same effect as an antibiotic, where you start to remove a certain bad gut biome, right? A certain what do we call these microbes? The
Microbes.
yeah, they start to decrease, and then the good ones start to increase, but then another one that's even worse can come in and take over when these two go into decline, because you didn't finish this one and this one is dying, but then it can create a different one that is even worse for you, or it just causes a different problem.
So when
Colonization, I think they called that, is
colonization. Yeah, you're right. And so when we're improving our gut health by changing our nutrition, and one of the biggest things, so we talked a little about probiotic, but the other thing is 97% of Americans are starving their gut microbiome. And the reason is we don't get enough fiber.
Yeah.
We don't get enough fiber. And so fiber, plant-based fiber, okay, basically it's a prebiotic. Prebiotic is what feeds, the prebiotic is what feeds the good gut bacteria, the ones we want. Okay. And so how do we get that? Well, the non-digestible plant-based foods, the fibers that we don't digest. So when you have, say you have 10 grams of carbs on a label, and say you're diabetic, they ask you your net carbs. So say you have 10 grams of carbs and 5 grams of that is fiber, and 5 grams is sugar. You take the 5 grams of fiber off and you really have a net carb of 5. That's all we care about, because the 5 grams of fiber don't get absorbed. What are they there for? They're actually going through our body down to the lower intestines to feed the good gut bacteria. Okay, guys? But here's what happens when we eat a Western diet with highly processed foods and refined sugars. What happens is we strip the fiber, and then they try to put the fiber back on, and it's not the same. Okay. So when we start eating the foods and getting the fiber and nutrition in that we need, we actually are feeding our good gut bacteria that fiber, and that goes up. And when that goes up, okay, we need good gut bacteria, because what happens is that makes short chain fatty acids. Okay. Have you gone down this road already?
I have gone down this road already.
And short chain fatty acids are only made from the good gut bacteria, which are they're being, fed the prebiotic fiber. So the plant-based fiber that we're not digesting, that gets all the way down to the lower intestines. And then what happens is those are really beneficial, because what happens is, so we have these microbiota with digestive enzymes. They eat up this indigestible fiber that went all the way down to the intestines. And then we create these short chain fatty acids that actually have antioxidant effects, anti-cancer effects. They help with allergic disorders. They help create anti-inflammation. They decrease visceral fat. Visceral fat's fat around your organs. You can be skinny.
The bad stuff.
You can be skinny and be unhealthy. So I never go by a size or numbers. I try really hard. I want people to get a weight just for a baseline, but I'm looking more at other things, because I don't want people fixated on that. Because if you're eating the right foods, then you don't need to worry about all that. Your weight will come off. Things will happen in the right order. But what we're doing is we're decreasing the inflammation, right? Well, we don't want inflammation, because we know that's going to inflame the vagus nerve, which is going to interfere with our mental health and the neurotransmitters going. We know that the inflammation, when we create it, it's like inflammation is like being lit on fire. It's like chronic smoldering across your whole body. And that's when we get those symptoms, the pain, the bloating, and all that. Yeah. So that's why we need these short chain fatty acids. And the only way we're going to get them is by eating these fibers and plant-based foods that are going to feed it. And we're not doing that in our country. I think I was just reading, for first world countries, as far as in 2015, our longevity, life expectancy, we are ranked 31 in all of these countries, but we are ranked number 1 for healthcare expenditure per capita.
Yeah. I really kind of can't believe that. I was looking at a thing today that was ranking highly processed food, literally Lucky Charms above more natural foods. Did you see that on the Joe Rogan
absolutely
podcast.
throws me for a loop. I can't. I mean, that's all fake food. Anything that says bioengineered or you can't, farm to table, like, yes, we're going to eat some processed foods. That's just going to happen. But we have to really read those ingredients and get rid of these preservatives and these dyes and the fructose and all the sugars. It's just, that's another thing is when we eat these high sugar foods, we're confusing our body. And so it's hitting our dopamine pathway, and it's really a food addiction. These companies know that if they put certain chemicals and certain types of sweeteners and things in the foods, it's going to make us addicted. So we want more and we eat more. Why? Because it's devoid of nutrition. So when we have, and this was a dietitian that I follow that I love, when we have chronic nutritional deficiencies, we have chronic food cravings, we have chronic weight management issues, and we have chronic cravings. Crazy, right?
Yep. Yeah, it's weird. You'd think they should satiate you, but they do not.
No nutrients in it. So it's getting the right nutrition in and enough of it to heal our gut.
Foods. So I want to talk about ways of influencing our gut biome. How do we increase the good gut biome? What are some foods? And I've got several listed here. But you've
Okay.
already said eat veggies,
Mhm.
right? Are there specific veggies that you want us to eat, or does
You
just
actually
anything with
need a
fiber?
variety. You need a variety because different fruits and veggies have different fibers. So you really want a variety of foods. You want a colorful plate because you need those different fibers to feed your gut bacteria to get more diverse gut bacteria. So people who stick to just one thing, not as good as eating a variety.
Cut out sugar is another thing that will
Yeah.
influence your gut biome. We talked about
Refined
that.
sugars have to go. It's an inflammatory food. It's in highly processed foods. It ruins our gut microbiome. There are natural sweeteners that I use like stevia, honey, agave, maple syrup, those kinds of things I'm okay with, but refined white sugars and all of that go. Cane sugar is okay, but obviously we're trying to not eat too many sweet things, but because we're trying to have a
Natural
more
honey.
natural sweeteners.
Yeah,
Mhm.
natural honey is it is most of the honey that we eat in the US is just refined sugar and made to look sticky. Natural honey. Yeah, Lindsay was talking about how, yeah, it's just corn syrup, but Lindsay was talking about the other day that the best way to eat honey is eat local honey. Find a
True.
local honey vendor that it came from hives in your area. And the only way to know that it works, that it is real honey, is at room temperature. It should not be runny.
Well,
It should.
that's a trick I didn't know. Thanks for
Yeah.
sharing that. That's a good
Yeah.
trick.
Natural beeswax in the honey is waxy and crystallizes at room temperature. So
Okay.
if you have something at room temperature and it is runny and looks like flows and the bubble moves back and forth, it's not honey. It's not real
Okay.
honey.
Well, I like that. I love learning. See, we're teaching each other. I love that.
Another thing they say is avoiding antibiotics.
So, that's a
speak to
hard
that?
one. So obviously we need to realize that there is a place for antibiotics, right? Because there
Yeah.
are bacterial overgrowth and things that we won't be able to fight off without an antibiotic. And for the short term, if we need it, we can always heal our gut. We can get our gut bacteria back to where it needs to be afterwards, even though it's going to take a hit, because you absolutely need we always look at in medicine, risk versus benefit. So I've been in healthcare long enough to know, am I antibiotics? Absolutely not. There is absolutely a place for them. I've seen amazing things. People could die without them. So thank God we have them. But the thing is using them for the right reasons and not over prescribing or being quick to just give a prescription so they don't come back or whatever it is. So prescribing them in the right cases, so not abusing them, which we're trying to get better about in the medical field anyway. That's a big push. And then, but if you do need it, taking them. But do antibiotics temporarily disrupt your microbiome? They do.
Okay. So, okay. I love your thoughts on that because I was confused. How do you do it? Because I've been prescribed the antibiotics and it helped me.
Yeah, you absolutely need it because risk versus benefit, you have an overgrowth of bacteria that you're not going to be able to fight off without it.
Dairy sources, it's in a lot of dairy. Good microbiome, the good gut microbiome is in dairy.
So I actually avoid dairy. I like to put people on an anti-inflammatory diet and do things that are non-dairy because dairy tends to trigger a lot of inflammation in a lot of people. Now, once we reintroduce certain foods, and I'm not talking like crazy restrictions, like this was easy for me to do in a busy pediatric clinic. And I was a huge dairy person and bread person. So when I tell you I went off gluten and caffeine and the refined sugar, like I did that, but I felt better so fast. It was easy to follow. And when I reintroduced things back in, it teaches you how to be in tune with your body, what I'm doing. So when I put you through a 30-day kind of gut reset, and then we start introducing things back in, if you're ready on that, hey, okay, I'm ready. I feel good. I hit my goals. I want to go into maintenance. Okay, well, let's slowly introduce things in and let's see what your body does. And when something messes with you, let me tell you, your body will scream at you and you'll know right away because you're more in tune to your body now. So dairy's one I do take out, but there are some people that can handle it. I'm not one of them. Other people can, but usually that's a pro-inflammatory food. So that sugar, the fast foods, gluten, you don't necessarily need to have a gluten allergy or be a celiac person to have a gluten sensitivity. And what happens is there's this protein gluten can create in people in their gut that opens up the gut lining junctions that are keeping basically, it's the barrier that keeps the toxins and things from getting into our bloodstream. And what happens in a lot of people, I'm one of them, is that they're sensitive to gluten. So those junctions get loose when you eat the gluten because it creates this protein. And then things are getting out and inflaming your body that are going through your gut mucosa that you didn't realize.
That must be why Keith's doing it. Keith, we went to dinner with Keith and Lynn the other night, and they were doing that. Keith's here right now, but
yeah, I take gluten out. And for me, I'm very sensitive. So I can't, if I have bread, I'm on fire. My whole autoimmune will flare up. So for me, I just avoid it.
where do you stand on fermented foods?
You know, they're great. It's hard to eat enough of them.
Is it?
They're saying you need like 6 servings of fermented foods a day. I'm not someone that likes fermented foods. I mean, we're talking sauerkraut, kimchi, kombucha. Oh gosh, I had kombucha in Hawaii. I thought I was going to die. I was like, I can't do it, man. I can't do
I
it.
can't either.
Like, it's a
I don't understand why they're doing it.
placenta.
Oh,
Placenta.
Placenta.
That's how they make it. My friend used to make them. I was like, no, I can't do it, man. I can't do it. So sauerkraut, kimchi, kombucha, yogurt, I just don't like those foods. They say you need about 6 servings a day. So like basically what I do is I'm like, hey, I'm eating really healthy and I have a probiotic that I know is working for me. And I can tell my gut is healthy because my inflammation is down and I'm thriving and I'm feeling really good. So what I'm doing is working for me. Could I tweak that and add some fermented foods? Fermented foods are great for you. So if you like those foods, absolutely, it's great to incorporate it. I'm just not one of those. Part of the problem with being able to eat the way you need to eat to really support your gut health, the amount of meal prepping and the amount of things that you would have to eat takes a lot of time. And so that's why the program I'm using fills in the nutritional gaps so that it's easier to get your gut healthy faster, because we're always looking for the easy. I couldn't have done the traditional one. I would have gagged if I had to go into clinic drinking kombucha.
no,
I
tried it.
I would have died. I don't know if that was the only way. I don't know what I would have done, but I found other ways that worked for me and have worked for tons of my clients that, but by all means, that is absolutely great for you.
Yeah, I tried it. I can't do that fermented food stuff, and I won't. I won't do it. So that's a no. You got a question over there?
Keep going, but
Okay. Well, let's talk about that. You said you keep mentioning this thing that you do that is your thing. People can come here and they can reach out to you, DM you, and talk to you, set up a thing.
Yeah, if you guys are interested in having a health consult with me, and like I said, it's no obligation, guys. So my mission truly is to positively impact your health through education and coaching. Okay, I have a program that I've been using for years. I'm going on 3 years now that has absolutely changed my life and so many of my clients. I mean, just absolutely life transforming. So I have a program and some products I use because I believe in them, because they're tried and true, because medical doctors sit on the panel of what I'm using. So great. But what I do is I still individualize a plan. I still consult with you guys to figure out what you have going on. Are there things you can't do? Some people, especially you guys already on a health challenge, have done a lot of great things. So some people are really far off and some are halfway there. So I really just need to get an idea of where you're at, what your goals are. my goals aren't your goals. It's you drive the train and tell me. We do an assessment. We figure out what you've got going on and where you want to go. And we come up with a plan. I have 30-day health groups where I put out education. We do coaching, accountability. But I also, what I love about overlapping and aligning with you guys is the exercise is also anti-inflammatory, and exercise also boosts good gut health. So a couple of things when we look at it holistic. So I always focus on nutrition and the gut being the command center. And this is all about the gut microbiome. But when we branch out from that, there's other things we're doing. One, why am I part of Rewind, and why do I absolutely love this program? Because what Neil's doing is anti-inflammatory.
And Lindsay, of course. Yeah.
And Lindsay, that's right. Sorry, Lindsay, you're out of the picture today because I
know
can't.
I kicked her out of the picture. She's over here doing the thing.
Kicked
Sorry
you
about
over there
that.
to be on the computer. No, I'm kidding. But so it's anti-inflammatory, and it does promote good gut health. But another thing that people don't realize is sleep. Sleep is such a powerful medicine for our bodies. We have to get at least 7 hours of quality sleep a night, or all the healthy things we're trying to do out the window. That's how powerful sleep is. So making sure you're getting 7 hours of quality sleep, but it's also this catch-22, because if your gut's unhealthy, that can interfere with your sleep. So it's also getting your gut healthy. And then the other powerful thing is I'm very holistic. So it's the mind, the body, but also spiritual, and being able to control stress and doing things like meditation and other things to help control our mind. There's even studies out there. I don't know if you've kind of gone down the neuroplasticity road and seeing how you can rewire your brain by minding your mind. And have you gone? So we used to
A
think
lot. I am absolutely
totally there, right?
I love that stuff.
Yeah. So not only are we changing our moods and maybe even some of the mental health aspects, at least how severe they are, by managing and getting our gut healthy, but we're learning now. We used to think that your brain, like once it was developed, and the way it was wired. Well, we're all wired negatively, our brains, because that's how we were wired innately to survive dinosaurs.
Right.
Like that's where it comes from. Okay. Like fight or
Saber-toothed
flight.
tigers and bacteria and all of it.
That's exactly it. We were designed to survive, but those things aren't needed to that extent now. And so it's being able, you can actually rewire and condition your brain. So some people are going to be a little more negatively wired. Some people are naturally going to be a little more positively wired. Some of that comes from experiences. Some of that comes from genetics. I always laugh because my mom was always the glass half empty. I've always been the glass half full kind of person. That's just the way I'm wired. However, in doing some of the studies, not only getting my gut healthy, but the neuroplasticity, where you can rewire the connections in your brain and you can retrain your brain to look at things and focus more positively and get yourself out of that fight or flight, or get yourself out of that fear kind of rabbit hole. It's actually improved even more from what I'm seeing in that research and what I'm applying to myself and even my clients. Incredible.
Yeah, I've been fascinated by that stuff. I read a book called The Happiness Hypothesis, and that's what it postulated. It talked about how you have X amount of happiness. The problem is most of us never achieve X amount of happiness. And, you have most, like, I'm kind of a curmudgeon, so I have this much happiness. And then you're a big personality, and Lindsay's a bigger
Lindsay's out here too.
Yeah. So she's got these big, you guys have this much happiness. And the thing is that all of us are wired to do well on the happiness that we have. So this is how much I get. The problem is that if my microbiome isn't intact, or I'm not using all the right skills and abilities, then this little bit that I do have becomes this. And that's where we get unhealthy. I loved that book. It was a good book. Happiness Hypothesis.
I love that.
Let's wrap this up. I have enjoyed talking to you so much, and I've enjoyed so much having folks on here with us. Before we wrap it up, I did this last week and I didn't have anybody ask any questions. We just like, goodbye, everybody. So if you do have questions, like, now would be the best time to bring them up. Like, we have Linnea right here on the feed with us. So
questions. And if you're interested in getting a health consult, comment. You can also private message me, but if you just put a comment that you're interested, I can reach out to you and we can set something up where we can talk.
Lindsay put your information on the Facebook challenge page, so it's the top post right now.
Oh, perfect.
For that.
Okay.
So, and you put it in the feed also. So yeah, she's also put it right here.
I am so passionate about what I get to do. I've always been passionate helping others, serving others, being in the healthcare field. I feel very blessed to have that career. I'm sure Lindsay can align with that because what we do is incredible, what we do to impact others. But getting into this holistic lane while we're waiting to see if there's questions, when I was saying that I started this health journey, but my son was active duty. He was 25 years old and he got diagnosed with a stage 3 soft tissue cancer when he was in Germany. And this was December 2020. I took emergency leave from my clinic job and I went to take care of him. When I went to Walter Reed to take care of him in the Wounded Warrior Barracks, that's when I was starting GPP. Well, I would always done GPP, but that's when we were doing the rewind kickoff and you guys were doing Facebook Lives, which is what got me going into this realm. You guys pioneered that for me and led that way. And it was COVID, so everything was shut down and I couldn't work out outside. So I literally had this little room in Wounded Warrior Barracks that I had resistance bands and some weights, and I would do rewind there, and I was having great results. Great
I
results.
love that. I loved watching you do that. It inspired us so much when we were.
Saved my life because of the community you guys gave me. Saved my life. It was the most amazing outlet during a very difficult time. A few months later, I get a call. I was one of the top providers in my clinic and always had great reviews, loved what I did. And a few months later, I got a call. Hey, Linnea, top review, doing great, call HR. And I called HR and HR director got on the phone and said, Miss Baker, didn't ask about my son, just said, Miss Baker, it's in your best interest to resign. And I was in the middle of Taylor, like almost dying and being admitted to the ICU. He was
in 2020.
This was in
the whole world was on fire, and then
2021.
your world was on fire even more specifically. Oh,
Wow.
And so I said, what are you talking about? I thought they just needed more paperwork. I had active duty chiefs of all the different surgeries and oncology sending them paperwork saying, we need Linnea here for like 6 to 7 months. I was on family emergency leave. And she said, if you don't resign, we're going to terminate you for being AWOL, even though I was a civilian. That's away without leave. They were going to fire me. I was a civilian. I had so many people tell me to fight it, go to my senators. Walter Reed actually wanted to hire me, but by the time I would have onboarded with them, I would have been leaving. So at that point, when you have something like that happen, you step back and you really put things in perspective. And I was blessed to know I can work as a nurse practitioner anywhere. I'm going to resign. I'm not fighting this battle because my energy needs to go to my son. Yeah. At that point, I was very invested in what you guys were doing. I was on all your community pages. I loved your Facebook Lives. And I stepped back because of what I had seen in my own health journey and what I was doing with you guys and what I was seeing. That's when I decided to go down the holistic health and wellness path, because I could help people and I could have the flexibility to do it anywhere. And I literally started working from my son's bedside in his hospital room, helping people on a health journey in between medical rounds to, 1, get a paycheck, and 2, because I love serving others and it was a great outlet for me. And I remember my first recording on my health and wellness Facebook page, I was inspired by these guys and I'd never done anything like it. And we're at Walter Reed and my internet is going out. We didn't have a good internet connection because of all the security. My son is bald, sick, had lost all this weight. He's sitting in the chair trying to help me with all the connections because he was so excited to do something other than cancer and focus on that. And he was helping me. I didn't have a ring light. I didn't even know what that was. I didn't know what I was doing. And that was my first videos, was at Walter Reed. We even made shake videos and my son would come out and he bought me I remember him buying me a blender. Mom, you need a blender. You can't use that little hand thing. And so he was part of you guys were a huge part of me starting down this journey. And I'm so grateful for you guys for having me on. I'm honored to get to be here. It's been a long haul, but you guys were definitely a part of where I started and where I am.
Well, we are so proud of you. Like, it's been so fun to watch you grow this thing that you do now.
Thank God for you. People need more people like you. Like, thank God for you. This is going to be a thing that it'll be great for everybody that comes in contact with this. So thanks. And thank you for sharing this with us tonight. I love our conversation.
Yep. You're improving lives. And there was no questions, but there was a lot of people saying that they wanted to get in touch with you and have the consult. Perfect. And just thanking you. So thank you, Linnea.
Thanks guys. Linnea. I appreciate you. Grateful
for coming on. Good luck to you in the future. And we'll keep in contact all the time.
Always. Thanks, guys.
Thanks so much.
Have a good night.
Have a good night.
Good night.